Hello again, this is Dr. Walker. We'll talk a little about type 2 diabetes. So welcome back, this is Dr. Walker again. This is the discussion about type 2 diabetes again in its simplest form. This is the discussion I gave to some sixth graders several years ago, and I thought maybe this would be applicable now in understanding what's really happening with type 2 diabetes. So just imagine you're having a party. And in your party, you're going to have lots of food, obviously. So let's say you're going to have food several times in that day. And you'd want to have some person who's sort of helping you at the door. So I call that person then Insulin the Bouncer. So Insulin the Bouncer comes to your house when you have lots of people or lots of food that needs to go into your house or into the cell is what I call that. So let's say you're having breakfast now. You have breakfast, your blood sugars go up kind of high, and then your pancreas then sends Insulin the Bouncer to your house, to the cells, to open the cell or the door of the house and let those glucose molecules into the cell. Now, Insulin the Bouncer will stay there the entire time that your blood sugars are high or people are coming in. We'll say they're sort of opening and closing the door each time the glucose molecules come to the door, lets them in, closes it once it's in, another one comes up, opens the door, closes the door once it's in. At some point though, the spike from the blood sugar or the amount of people coming to your house is decreased. So then Insulin Bouncer goes back to the pancreas to say, hey, all is well, things are good, we don't need to send anything else out to those cells. So both are relaxed. Now the cell's good, the house is closed, the pancreas has Insulin Bouncer back in the pancreas. Now you're going to have lunch. Same thing happens again. You have your lunch, then the insulin goes to the house, opens the door because the sugars are high now. Sugar goes in the cell. The door is closed by Insulin Bouncer again once the sugars are done. Opens again when another molecule comes in, opens the door, it goes in, closes the door, and so forth. Happens breakfast, happens lunch, happens at dinner. Sort of the same thing. Insulin comes out there again, opens the door, glucose goes in, and the Insulin the Bouncer will go back to the pancreas essentially to say, hey, listen, stand down, all is good. The glucose levels are back to normal. Now, just imagine though, it's a little bit more than that. So now let's say now you're having people coming to your house all day long. In other words, you're eating food all day long. Glucose levels are high all day long because now you had breakfast, but you're gonna have to snack in between breakfast and lunch. Then you have your lunch, and you have another snack between your lunch and dinner. So the glucose levels are always high, which means that Insulin Bouncer stays at your door, at your house, at your cell, opening the door all the time. Glucose goes in, but it's always opening and closing that door. So it never goes back to the pancreas to say, stand down, all is good. The pancreas then gets worried to say, what happens to Insulin Bouncer? Where is he? Why is he not back to me to tell me that everything is good? So then pancreas then sends another insulin molecule out there to the cell to say, hey, where is Insulin Bouncer? Where are you? So it spends all this time looking for insulin to say, all is well, glucose is fine, but it also doesn't come back. So the pancreas again sends something else out, looking for what's happening because it's not getting the feedback to say, glucose levels are normal, stand down. After a while, as you can imagine, both the insulin at the door gets tired. The pancreas has no more insulin to send to the house, to the cell to open the door, to let glucose in. It just says, you know what, I'm done. I can't do anymore. The pancreas is now exhausted. Insulin is now exhausted. It doesn't work. Pancreas doesn't work. Nothing works. At this point, now you begin to feel some side effects from high glucose levels. So now you're feeling that you're thirsty, you have blurry vision, you can concentrate, and again, all sort of side effects of high glucose levels. Again, because your insulin's not working anymore, insulin's not opening and closing the cells that it should, so things are just going crazy for you at this point. You go to your doctor and says, Doc, hey, listen, I'm not feeling so well. I'm not seeing very well. My vision's blurry. I'm peeing all the time. I'm thirsty all the time. What's wrong? What's wrong? So the doctor then says to you, oh, no worries. You may have diabetes, and they test your blood, and it's greater than 126, and a couple times in a row, you're diagnosed now with diabetes. And so one of the things that they will then do for you saying, okay, well, you're diabetic. Here's some insulin for you, right? That's sort of the wrong thing to do though, right? Because your insulin level is already high. You're giving the person now even more insulin. And the reason for that is because it's saying, hey, listen, I will get the glucose levels down some way or another. So in other words, since it gives you more insulin now, more injectable insulin to go to your cell to find any possible way to let glucose into your cell, right? It does that. You get more insulin and more insulin from your doctor because over the years now, the couple of units that you get at the beginning is no longer effective, so they have to give you even more. Now at some point, your pancreas is no longer making insulin. The injectable insulin you're getting from your doc, that doesn't work anymore. In fact, nothing works for you. So now your insulin levels are higher, probably normal, and your glucose levels are just sky high. Now, both insulin and glucose are sort of toxic to your system. So again, you get problems with your eyes and your kidneys and your peripheral nerves and your brain and memory loss and all of those things sort of in concert, all because insulin levels have been so high chronically. Now your glucose levels are high chronically, nothing else to do. You become a dialyzed patient. Now, all of this could have been prevented from a long time ago, right? So when you start having problems or symptoms, had your doctors check your insulin levels to begin with to see that they're high to begin with, they would have realized that you're pre-diabetic and you're going to run into a problem long term where the insulin is going to become exhausted and or your pancreas have no more insulin to help you, right? They could have checked this a long time ago, but they did not. So let's forget that. But now they give you even more insulin, which again makes kind of no sense, but that's what we do collectively. More insulin on top of your already high insulin levels to sort of force that insulin as best as it can into that cell for you. All of this, though, can be prevented by what we're talking about. Walking, exercise essentially, is one of those things that helps to utilize the glucose in your system, in your skeletal muscles, in your body globally. That would be one thing you can do. The other thing you can do, as I mentioned before, is to simply give your pancreas a break. Many of us, when we have our breakfast, lunch, and dinner, it's typically a high carb, high starch diet. All of those glucose molecules in that you've now consumed, strings of glucose molecules into starch, which then drives your insulin levels sky high, right? Which means that you're always taxing your pancreas to send more insulin to drive all this glucose into your cell, right? So if you did not have breakfast, lunch, dinner, and snack in between all of those things, your pancreas could get a break. Your cells could get a break. The doors wouldn't have to be open and closed so much, so that the cell doesn't get ruined long term. The pancreas is sort of have sort of quiet time, right? So it's fixing itself. It's fixing the rest of the body because it's not being tasked to sort of produce more insulin all the time. So eating fewer times in the day will help you have that sort of break that your body, your pancreas, typically will need. Now, I would say you probably should eat no more than twice in a day. Goes back to my 16 8-hour fasting. So eat for 8 hours, fast for 16 hours. That's one way, again, of giving your system a chance to get a break, relax, and essentially regenerate the cells that's been sort of being tasked the entire day. As I mentioned before, walking is also, again, a great sort of process in terms of forcing that glucose into the cell. Drinking water as well, flushing sort of the toxins out of your system, flushing your kidneys really well, your tissues really well, you're better for that long term. That's my discussion on this. Now, this works. This works. So the key piece to sort of all of this is the amount of time that you're eating during the day and taxing your system in terms of overproducing insulin that long term fails. You will fail. It'll fail you long term because it doesn't have that energy, essentially, all that drive to give you as much as you're asking for day in, day out, years, decades, long term. At some point, it begins to quit. It's like having a car that you're driving cross country, without stopping. At some point, it's going to go kaput. It's going to quit on you, right? As opposed to if you're going to drive the car, stop it, get it repaired, get it fixed, continue driving. One of those two conditions is going to last you longer, right? The one that you're driving, stopping, getting it fixed, it's going to last you a whole lot longer than driving the car back and forth across the entire country without stopping, without getting your car a chance to get repaired. Same thing with your cells. If you don't give your pancreas a chance to relax and take a break, and your cells a chance to relax and take a break, it too will fail you long term. And the end result of which is perhaps the most devastating thing I can imagine is being a person who is being dialyzed typically Monday, Wednesday, Friday, Tuesday, Thursday, Saturday, one of those, and your entire day is in a building, in a place, getting dialyzed. That is the end result of long-standing diabetes, where insulin is no longer a factor, can't really help you, and your blood sugars are chronically high. Anyway, I hope that helps. If there are other things that you do to sort of keep your body in tune, keep your weight low, keep your glucose levels low, keep your insulin levels low, let me know. Leave it in the comment box below. Otherwise, Dr. Walker again. Stay well, stay fit. Talk to you later.